Good afternoon, and welcome to Tackling Provider Data Challenges to Facilitate Patient Engagement and Improve the Bottom Line, a Health System CIO production sponsored by Kairos. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I will be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we will take them later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35 to 40 minutes with our main panel discussion featuring Will Landry, SVP and CIO at Franciscan Missionaries of Our Lady Health System, Mona Bassett, VP of Digital Services with Intermountain Healthcare, and Paul Merrill, President with Kairos Health. And then we will have our Q&A. So let's jump right in. Will, can we start with you? Let's get an overview of your organization and your role.
Sure. Yeah, we are a Catholic-based health system based in Baton Rouge, Louisiana. We have 10 inpatient facilities and a couple hundred ambulatory facilities in Louisiana and in Mississippi. We also are a large Epic Community Connect partner where we have other independent health systems that run off of our digital platforms. And we've been using Kairos, I believe now since early 2020. We went live with Kairos as far for online scheduling and for provider data management. And like I mentioned earlier, we are an Epic shop and Epic in all of our inpatient and ambulatory facilities. And I'm the Senior Vice President, Chief Information Officer, and also lead a lot of our digital health efforts for the health system.
Very good. Thank you, Will. Mona?
Hi, everyone. I'm Mona Bassett. I'm the Vice President of Digital Services for Intermountain Health. And Intermountain Health is based out of Salt Lake City. I am in Denver. And we are a large not-for-profit health system covering 7 states, primarily in the Mountain West. And we have almost 70,000 caregivers who work for our organization. So really large organization trying to improve the health of our communities across the board. My specific role over digital services really focuses on consumer engagement and caregiver engagement technologies and the strategies that help enable those great experiences. We are actually a hybrid kind of organization. We are moving to Epic, but we have a few of our regions on different EHRs. So it's a little bit of a complex landscape, but we are working toward unifying that.
All right, Mona. Very good. Thank you. Paul?
Thanks, Anthony, and thanks to both Will and Mona for being on with me here today. As Anthony shared, my name is Paul Merrill, and I serve as president here with Kairos Health. Kairos is a SaaS company trying to solve the problem of care access. So we work with health systems, independent medical practices, and health plans to solve the problem of provider data management, as well as all of the different apps that leverage that data to meet the member or the patient or the consumer wherever it is that they begin their journey for care. We've been at it for about 14 years, so we've learned a lot over that time frame and really started to help better understand what it takes to service about 1,000 or so hospitals that we work with today, about 100 or so different health plans, and another 500 or so medical groups. But really looking forward to the conversation today.
All right, Paul. Excellent. Thank you. Will, we're going to start with you. How do you view provider data management as part of your larger data or master data management strategy?
Yeah, I think it is a critical piece because many of our data, and I'm sure we'll talk as we get through this conversation, all the digital health tools that we have almost all tie back to provider information or who our patients want to meet and meet up with or are matching up with. And I think that so it is a critical piece. It is also, while we're having this, it is a very difficult piece for us to manage because not only are we have employed, we're dealing with employed providers, obviously employed APPs, and then we have med staff team members, and then we have community providers as well too that we're partnered with in different situations, and not all contracts and partnerships are the same. And so it is definitely um, kind of one of our more cumbersome areas that we have to manage data, which I'm sure is similar for a lot of other. But it is critical. Like it is now that we're moving forward with more. Obviously, COVID helped kickstart a lot of our digital tools utilization. We were doing a lot of it before, but it exponentially since. And it is becoming critical that the data is better and cleaner and more up to date and more real time than ever before, because that is what our patients and our consumers expect.
Very good, Mona.
I feel like, Will, your comments are really point to the fact that I think this conversation might be a therapy session also for all of us. Very, very similar environment here at Intermountain Health. Certainly, provider data is critical, and managing that data is critical. That data helps feed so many other downstream channels. So, I mean, just thinking about the consumer facing space, the data feeds obviously our provider directory. It's attached to our location listings, even on our website. It feeds our business listings in Google. So it's really important to get it right. And I think we have a little bit of an extra challenge because we went through a merger just a couple of years ago. And so we still have data in different places. So how do we make sure it's all accurate and it's feeding all into a single location? Those are really what we're focusing on as part of that larger data management strategy.
Very good, Paul. What are your thoughts on what you're hearing?
Yeah, I mean, it's interesting. I think sometimes organizations believe that provider data management and master data management are sort of synonymous, meaning they're the exact same thing. And the question almost becomes, why should you think of provider data management any differently? And I think what you just heard from Will and Mona get at the essence of that, right? There is the generic MDM being applied to a domain that it may or may not understand. And there's some natural questions that come out of that, meaning, do you understand the attributes? Do you understand the integration with the underlying systems of record, the data freshness and things of that nature? But then there are, folks like Will and Mona really deal with complex issues like the same data existing in many different places and not really knowing which one is the source of truth. So this federation of content that really impacts the consistency and the quality. And if you think about that as the foundation then to service all of these entry points to the delivery system, it becomes a really much more mission critical element of the overall MDM strategy. And I think that's the thing that often gets missed when people are thinking about provider data management. It's the federated nature of it and the real-time nature of it as it relates to both what your patients are trying to decide, but also fueling your internal operations.
All right, very good, Paul. Thank you for that. Mona, we're going to start with you. Why is a foundation of accurate, accessible, and easily searchable provided data integral for organizations to power both consumer experiences and internal operations? And what are some of the reasons this is a difficult challenge to master? You mentioned disparate EMRs, either as a result, it could be the result of mergers and acquisitions. That's one of the reasons, but any other thoughts here?
Yeah, I mean, I think it's just so important to get this right, as I mentioned previously. And the data is obviously needed for internal operations and just about every consumer experience in the digital and contact center spaces for that matter. And I especially am concerned and thinking about self-service, where we are empowering patients to take charge of their own health journeys and give them the option to do that. And the data has to be right for that to work. And we really only get one, maybe two chances to get that right, because as people are choosing the digital space as their engagement channel of choice, they are not going to be very patient to wait for things to be right. So they're going to try it. And if it's not right immediately, we're going to lose them in that space. And that is really not something we want to have happen. Certainly I would also say that, as a result of merger activity and integrations and there's data coming from so many different sources, lots of different teams, different regions, and it makes it difficult to ensure that that data is accurate. So as we really worked to align all the processes, so even if things are messy in the background, we can still bring them into sort of a single front end data source like a Kairos. And we're seeing a lot of improvements in the accuracy of the data, a lot of improvements in the processes that we've put in place to ensure that data flow is timely. And so certainly all those activities have allowed us to be able to provide this amazing self-service experience that is right the first time, and people are confident that they'll be able to get their tasks done.
Yeah, it's such an interesting point about that you sort of get one shot, like, a new restaurant opening. You go in, you try it out, it doesn't work out, you may not be ever coming back. Um, are there any sort of launches or grand openings of digital tools where you could say, all right, we're not going to, because there's marketing behind these things too, right? If we have a new consumer facing tool, we're going to do marketing behind that. We're going to have some kind of a launch. Let's get our house in order before we do that, because if we make big fanfare for everyone to use this, we want to make sure it's ready because they're not coming back. If they come in and they look up some physicians, they're putting in some filters, they're trying to find the right physician, and maybe I don't know how many parameters they can select, but they wind up reaching out or trying to make those appointments. It turns out for whatever reason, it's not right. It's not the proper fit. They don't take the insurance. They're not around anymore. They're done. So any more thoughts, Mona? It's a great point.
Yeah, the interesting thing about that is, to us, the digital space is sort of table stakes. And we actually don't do a lot of big splash marketing when we update features and functionality. What we want to be sure happens is that the channels where people are visiting already, because they're visiting those channels in their other portions of their lives, like retail and banking, that it's so intuitive that we don't need to give them a lesson on sort of what's changed. We don't have to have a big splash. They just come and they use it. Think about, Amazon. I love, the Amazon comparison. They don't do a lot of big splashes on functionality. It's sort of there when you get there, and you kind of expect that they're going to be improving things along the way. So things are good, and then they get even better. And that's
Mm.
really the approach that we like to take.
Well, what I'm thinking of is if the data is a mess, and you do a lot of work to clean it up, and again, maybe we're getting off topic here, but the idea of letting everyone know, hey, come back and check it out because it's better. Because I've had experiences, usually dealing with an insurance company, or insurance. You go on the website, you're trying to find a provider, and again, a mess, not applicable. People are no longer there. They no longer taking the insurance. So you go, I'm done. If they sent out an email at some point saying, hey, we cleaned it up, it's a lot better, I might go back and check it out. I don't know if those things kind of come up when you're dealing with provider data.
We haven't. We've been very similar to what Mona mentioned. I think 5+ years ago we would have done more marketing, like regarding, hey, my chart's out, or we're doing this video visits now, and we haven't done that type of mass market or like those types of announcements or grand openings in a while now. Mostly because for the same concerns we just talked about. We're looking to do soft launches with our employees. We got 20,000 employees that we can do testing with and soft launch production. And then also with like our family and friends, right, too. Like anytime we release something new, I tease that like my number one beta tester is my wife, because she will tell me what's not working, and she will give me a very honest opinion on what she doesn't like about it. And so so and we get a lot of that good, really positive, I mean, it's constructive feedback that we can go and make adjustments. And a lot of our digital health does the same with like their family members and friends that they know are actively using and engaging with healthcare or our providers. And so I think that's been very helpful. And like the same thing, it's word of mouth and social media. We've been using a lot more of that when it comes to like, hey, like improving their systems and like doing it that way versus like these big grand opening launches.
Mm-hmm. Mm-hmm. Paul, people bring you in because they have a problem, right? Things are messy, things are not working out, the provider data is not useful, it's not right. You can come in and help us. And tell me about like do you do like you're not just giving them the tool. You're probably giving them a lot more information about how to improve themselves in this area, and they may make exponential improvement. Do they then want to let everyone know, hey, come take a look again, take another look? Have you had any experiences with people like that?
Yeah, I mean, it kind of gets to the foundational question of what does success look like? What does good look like? And we oftentimes encourage our customers and partner with our customers to just take a great baseline in terms of what are the key things that matter to your organization. And that might range from how you're doing SEO to conversion rates throughout the patient life cycle of various funnel metrics, all the way to frequency of inbound calls to your contact center that are asking questions about data accuracy. And if you establish a nice baseline and then you go through the hard work of creating a single source of truth across what is a very difficult process, what you see is market improvement across each one of those key performance indicators. And it's not that common where we feel people doing the big bang. I mean, certainly people will all the time say, hey, we're going to launch a new website, or we're going to build a new mobile app, or we're going to now power my chart, with this type of experience. But it is more done in that soft launch way, and understanding, hey, we're going to do a little bit of A/B testing here, right? We have a foundation. We're going to implement some change, hopefully powered by a better and more rich data experience. And now we can see whether or not that's actually making a difference for our patient, for our doctors, for our operators across the organization. That's the much more common approach that we see and that we recommend with our customers.
Paul, you mentioned a couple times the single source of truth idea. Mona mentioned, a couple of EMRs there. Uh, Will is sounds like he's fully on Epic, which a lot of people go to Epic to solve that problem, to get that single source of truth. Source of truth. How would you describe how much more challenging this area is to be successful in this area when you're on multiple EMRs?
Yeah, I mean, I think that I don't know of any organization that we work with that has one data source that actually has an accurate representation of their providers and locations. On average, we estimate there to be about 115 data elements to provide an accurate and robust representation of a provider or even a location. On average, that comes from anywhere between 4 to 8 different systems, but it's not uncommon where that will become a dozen different systems, because it's not just Epic or Cerner or Athena Health. It's the credentialing system. It's the marketing database. It's the spreadsheet that Pete and Sally, manage in the contact center, right? There's all sorts of interesting data sources that become a part of this, ultimate representation. And frankly, a lot of times this data doesn't even yet exist. So I mentioned that we'll look at, key performance indicators like funnel conversions. Many organizations don't have things like a photo or a professional statement or a video, even languages spoken that are readily available in any one of those source systems that I just described. So you actually have to augment those systems with additional content, because you're doing so in service of the patient and to make sure that you're matching that patient with the best care for them. And there are a lot of different data elements and a lot of different underlying systems and a lot of governance necessary to make that successful.
Yeah, that's a good segue. Let's talk about governance, which I think is one of the most important things here. Some of the causes that we're talking about, disparate applications, multiple ports of entry, products, it may not apply so much here, but sometimes we get products being bought when we already have them, sort of a shadow IT, gray IT type thing. Things are popping up. And governance can really help with avoiding some of these problems. Again, when you've solved a problem, sort of like weeds, you don't want it popping up again. How have you approached data governance as part of your data management strategy to get everyone on the same page? So, Will, let's start with you.
Well, I think we had some good lead ups to this, and something Mona mentioned at the beginning, and what Paul just alluded to is, like I mentioned at the beginning, we're pretty much all Epic everywhere on our main sites. We have a couple ancillary systems out there, but for the most part, it's all Epic. But when we've done these Epic conversions and go lives at our sites, we have multiple different provider data managements, and sometimes we have duplicates of like the same application, right, in different markets. Well, we've looked at that and said, well, we already have this. It's already set up. We'll just use what they have. Well, it's not the same. And you guys, I mean, you guys know this. I'm sure you'll laugh, but we got go in and look at it. It's totally different fields, different setup. It's not really the same data. And because we're focused on doing an EMR go live, if they already have like this provider data management system, we'll just use what they have. And versus like going in and actually standardizing and centralizing. So what we've done going forward, and especially with like some of as we've continue pushing out or implementing Epic with like our community connect independent health systems, we've made that a big part of our discovery and upfront and understanding what do they currently have in the provider data management system, and making sure that there is governance around it, and that the data is standardized as much as we can, like, or in giving our markets and our operations teams guidance on what do we need from a digital tools perspective. Like, they need to understand what do we need, what is critical, what do we absolutely have to have, and then what's nice to have on the backside of that. So that has definitely been an area of focus for us the last couple of years as we've kind of moved past like our big EMR implementations. Now it's been really standardizing and doing data governance on that provider data.
Very good, Mona.
Yeah, very similar situation here at Intermountain. And I would say from a just overall enterprise data governance approach, we have a really good governance process in place. We're looking at where the data goes, how it's enriched, if there are any risks to keeping certain data, all of that. So I think that's in a great place. I would say when it comes to provider data, because of the different credentialing systems, different regions, it's still really a work in progress, and teams have to really continue to come together to simplify, to harmonize what we're doing across our regions, even 2+ years into our merger. So I think we are in a good spot, but it can improve. And it is certainly more complicated the more systems you have in place. And I think it will improve as we move every region to Epic, and it'll just be a lot easier to manage.
Yeah, Paul, you mentioned there's a spectrum of how many systems people have. The fewer the better. Does this get easier the fewer yet, or is that not accurate?
It's probably a fair general statement. I think you're still gonna, encounter the inevitable Dr. Jones exists in system A and system B. Dr. Jones has addresses, 1, 2, and 3, and phone numbers A, B, and C. And the question becomes, which of those data attributes are most relevant to which of your constituents, and in which form is the best way to help them meet their needs? So regardless of the number of underlying systems, you still have things like, oh, well, there's a billing address and then there's a physical address, and the physical address might be for the clinic and it might be for clinic A versus clinic B. Like there's actually an astonishing number of questions as you peel the layers of the onion on this that get very practical when you think about a patient calling into your contact center, or dialing up your website and trying to answer some pretty basic questions like, what phone number do I call to talk to somebody at the front desk? That is one of those annoyingly difficult questions to answer, despite the simplicity of what the person is trying to ask.
Yeah, and how much of getting that right, it has to be a manual process. So just to get it right the first time, or to fix the checking and then the rectifying of the data.
Yeah, I think the first question, this is why the governance topic is so important. This, in my mind, is part of data governance because you are identifying, what is the source of truth for an attribute for a user, and you can identify that through the implementation process and through your overall IT governance process within the organization. I think that's what you're hearing from Will. I think in systems like Mona has, where you have, more inorganic growth and more systems that you've inherited, it gets even more complex, but it's just the hard work of establishing it up front and then holding yourself true to it over time. I mean, this is not a one and done type environment with provider data management. It is a race with no end, and you have to treat it that way. I think that's a really important thing for people to understand.
All right, so Will, let's talk at a high level. Like, what are some of the things that you've done and that you would advise other people to try and do to get improvements in this area? And then sort of we have the concept in our heads of a major initiative to redo governance or make sure the data is right, and then we want to maintain. So it's sort of an improvement and then a maintain. You could think of it that way. But again, you sort of your best advice here on people who want to get their house in order in this area.
Well, a lot of it has to do with, and I don't know if we'll speak to a little bit more, but like the provider engagement, because a lot of it is getting the providers to update the data and making sure that the data is accurate. Our administrative tasks, I mean, staff can only do so much, and our systems can only do so much without them engaging. So one of the things that we've done that's been successful the last couple of years, we've done a lot of like consumer focus groups where we're going out to the market and the feedback is almost always, and we kind of guide it or not guide it, but we know what it's going to be, is that they need better, more accurate provider data. Like you mentioned earlier, language is spoken, insurance taken, like open schedule availability, and scheduling blocks and things like that. So we actively bring this back to our provider leadership and our provider groups, and are constantly pushing that message that this is what our consumers want, and this is what's out there from a competitive standpoint. And the other thing too is I think that's been helpful in driving some of this, although recently it's kind of taken a little bit of a downturn, like the Amazons and the Walmarts and the CVS's getting into healthcare or entering that digital market has helped us drive, like, oh yeah, like a lot of our providers are like, oh yeah, we need to do this now, like this is getting real. And so that has helped put pressure on them to do that. But it's really the provider engagement to making sure that they are validating what is in the system for them, because that's what's really important for their patients and for the patients looking for them.
It's really interesting, Will. Just as a follow up, you need to figure out what do patients want to see? What data do they want to see to make an appointment? And then you can create that list, and then you go to the providers and say, this is sort of the profile that we
Mhm,
think is useful to patients. You touched on a few things. Another example is, I think you may have mentioned it, next available appointment, right?
mhm.
Because we've all reached out to providers, and oh yeah, we could see you, especially if you're a new patient, we could see you in 6 months, right? Or we could see you in four
That's not.
months. So well, that's useless. That would have been really good to have as a filter, because if I want to see somebody within the next month, filter out the people that really have no availability or capacity to take me. But you have to come up with that profile before you can present it to the providers. And so you need that governance, right? Figuring out what data elements we want to provide potential patients is a governance process that's going to involve all kinds of patient advocacy groups. And any more on that, Will? And then we'll go to Mona.
I'll just add that the access availability is obviously the most is critical in retaining and capturing those patients, especially new patients, right? I mean, if there's no access availability, or we got all these huge blocks on the schedules, they're just going to move on to someone else, or they're just going to lose interest. And I think that we've really our provider group, not all, and in certain markets is better than others, but the ones that have seen it and understand that, we've seen like huge retention or huge capture gains in those markets with new patients.
Very good, Mona. Your thoughts on any of this stuff?
Yeah, I think, certainly providers are people too. They're consumers. They're consumers. They they shop, they buy things, they search for things, certainly outside of their work space and healthcare, and they're understanding, and they do understand the importance of a good search. So what can you filter down to? I mean, you think about just your regular shopping experience. If you're trying to find something, there are so many filters that are useful to you that you will click on and unselect to drive to the best, just the best result. And so we definitely partner with our providers to make sure that we have, the right information for them, their right conditions and procedures and specialties and all of that, so they can be sure that when consumers are searching, they're going to get the best result. I think the other thing, we know by looking at the data that comes out of our provider directory and just the behavior, is we know what helps with searches and helps people select. And that's making sure that you have a great profile, and a full profile. Your bio is there, you have photos, videos, and that impacts people's likelihood to actually click through on something. And then certainly, in many of our markets, there's not a lot of capacity, and it's sometimes hard to get in with a certain provider very, very soon. So we use the tool to be able to offer up different options for people. It's like, this provider is not available, but we have these other providers within the same practice. Also, have you considered a video visit? So really guiding people through that process is really important.
Yeah, that's excellent points, right? You sort of get yourself in that position of that patient and what information is useful to them, and all these options you talk about providing would be extremely useful. Paul, I want to bring you in. This idea of getting updated provider data is really interesting, and it's complex, and it's built a lot on relationships. I'm thinking how it's so much easier to get a snapshot of information than to keep information updated, right? You can go to a provider and say, what's your next available? You can give them that profile, whatever. Maybe they fill it out. That's a moment in time. That may have changed by the time you got that information updated to your website. And for these providers, especially, Will mentioned the ones who aren't employees, they may have privileges at 3 hospitals if it's in a city or whatnot, and they may have other places that want their schedule. So they may have a number of entities that want their constantly updated availability and schedule, and that may be a lot for them. They might not feel like that's scalable. They might not feel like that's their job. How do you, as a health system, get that information to be continually updated in real time? How do you get that to happen? Because again, we said that's critical. Go ahead.
Yeah, first of all, I think Mona did an outstanding job of describing the importance of engaging with clinicians in this and making sure they understand, frankly, what's in it for them and what's in it for their patients. I think that's a really important part of this journey. To your specific question, Anthony, look, this gets to the importance of having, a standards-based way of integrating with underlying systems of record. So depending on the health system or the provider organization, you need to be able to go into the practice management system and make sure that there are appropriate technical integration points and appropriate business rules around what it is that you want to expose to the outside world. That in and of itself, there's a technical challenge there that is very solvable. The business process change, the clinical process change is the far more complex part of that, because you're going to engage with clinicians that maybe they practice in different locations, or maybe even they're an independent practice or independent physician in a particular market. The reality is that once you dig into that schedule, you'll find all of the nuances in terms of how that physician likes to manage their practice, how they manage their schedule on a day-to-day basis, and it needs to be reflected in that practice management system. That's the only way you'll get the real-time information and availability information that we're describing. Then you also need to think about it in the most appropriate way. You kind of gave this example where, look, if you're looking out for appointments that are available 6 months from now, that's less relevant than, let me show you the 3 next available appointments that are appropriate for that consumer, that patient, and how it is that they're thinking. And like Mona suggested, offering them alternatives to the extent that Dr. Famous is not available on a time frame that we know is appropriate.
Mona, speaking of Dr. Famous, is there a reluctance sometimes on the part of providers to sort of give over their schedule because they feel they'll lose some autonomy and flexibility? Meaning, hey, don't worry about when I'm available because I might want to play golf, 3 weeks in the afternoon. So if I give you my schedule, I lose some freedom and flexibility. Is there any of that comes into play?
I think maybe back in the day, I don't think we see quite as much of that anymore. I would say that the more specialized a provider is, it's probably less likely that we would offer up self-scheduling for some of those providers, because it's, you don't necessarily want an oncologist to have self-scheduling available. And in other cases, I think with the flexibility of the platform, you can absolutely put in when providers are available, not available, because there are some sound reasons why somebody cannot be available during certain times, because they need to be available for emergencies or same day emergency types of appointments, things like that. So we don't see a lot of the other types of just restrictions to schedules anymore, because again, I think providers are really understanding the importance of giving people and consumers and patients options for scheduling.
All right, very good. This is an interesting and important question. How can IT executives find out if newly implemented changes are actually improving the patient experience around searching for and being matched with the right provider? So, Will, you talked about some of the things you do on the front end. Your wife is a test case, the IT department, the employees in general. So you have different sort of groupings or cohorts you can use to test things on the front end. Um, do you use those same cohorts in the back end? And how do you ultimately survey or find out if patients that are using these tools
Mhm.
are satisfied or pleased?
I will say that I do, is from my perspective, from like as a CIO, that what I mentioned earlier, like my family and friends is a really great litmus test to what's going on, especially like I mentioned earlier, my wife or like I got a couple sister-in-laws that live in the community where they're going to give me very honest opinions about the tools and what they think is going on or what they think should change. And so I think that's important. I'm fortunate that I have a lot of family that's in the areas and the markets where we have these tools. So I do get a lot of feedback for provider availability and or the provider search and information. So I think that's important to understand, and having that to have that kind of funnel of information. But we also, like I mentioned earlier, we also do a lot of consumer panels and patient panels where we're actually specifically at. Now we do a lot of a lot of it's regarding patient experience in general, but we do have specific digital tools sections, and as far as how they're engaging digitally with the system and getting feedback that way as well.
Paul, your thoughts on getting feedback on whether or not the experience is actually improving? Because and this came up in other discussions I've had, but we don't want to be in a check the box mode where, as an IT executive, we do certain things, turn on certain tools, and feel like we're done. If we ultimately want to make sure that the effect is the goal, the end effect, then we need to find out if the intended, target of our change is happy, because we may have turned on X, but they're still not happy. So your thoughts around that?
Yeah, I think Will hit on the two most important things, right? There is a qualitative element of this, meaning ask family members or whomever, and then the quantitative side of the equation. And I may have made reference to this already, but I think that looking at the basics of, I've got X search volume that converts to Y number of provider profile reviews that converts to Z number of calls to action. Be that a call into a spoofed call center number or launching directly into a booking experience. Those are all very, very measurable things, and you can tell when you've introduced a new end user experience or you've made changes to the underlying data, whether or not those things have been effective by doing that A/B testing that I had described, meaning pre-post, am I better or am I worse as it relates to those things? I would add that I think one of the things that is, I think, really important under provider data management is, once you've created that single source of truth, syndicating that content out to wherever it is that the data is most relevant, and it could be into your call center, right? So you've got what are the patterns in my call center in terms of the number of times that people are calling in for certain types of experiences, and again, how does that trend pre or post particular changes in either the applications or the data that we've made. So I'm a big fan of the measurement and the doing the A/B testing to see whether or not your hypothesis is actually true. I think that's a very powerful tool.
Excellent. Very good. So Mona, you're VP of Digital Services, Will, SVP CIO. Let's talk about the key players that an IT executive needs to work with in a health system when they're working on this problem. So Mona, what are some of the other, sometimes titles are different, so you can give me a mix of sort of titles and functions, but from your position, who are the key individuals you need to work with to move this forward?
Yeah, I would say the digital services team really works very closely with operations. So our medical staff services group, they are the ones who are ensuring that the provider data is accurate, is brought in to the appropriate systems very efficiently and accurately. I would also say that our marketing partners help us with putting together the best profiles and listings and ensure that we have all of the information that's necessary to really market that provider when people are searching for them. And then I would also say our consumer experience group, we work very closely with, because what we're really trying to do is, we talked a little bit about what data is available to ensure that we are improving the patient experience consistently. And they have really helped us implement things like intercept surveys in our digital spaces, where we can get close to real-time feedback on things around the ease of obtaining care, the sense of accomplishment, the emotions experienced during that digital interaction. So that really helps us improve. So I would say certainly those areas are probably the key areas.
Very good. Will, in your organization, who are sort of the key players you're working with on these projects?
Very similar, almost identical. It's it is the med staff office, like Mona said, med staff services, but ours is med staff office in the different markets. So like we basically have 6 different sets of med staff offices that we interface with. Our marketing team, and that's our and we have different marketing teams and different groups too, but we do have a centralized digital marketing for the health system, but the different marketing groups in the each market are we also work with. And our customer experience group, which we don't call our customer experience group, but we have within our accountable care organization and our clinically integrated networks, we have like a customer experience team that is in that, and that's what they're focused on. And they're a huge driver in how we're presenting this data digitally. So because they're doing a lot of our customer experience metrics from a patient quality standpoint. So those are, and obviously the digital health teams and our IT proper teams and how we're dealing, like how we're showing stuff in our EMR through my chart is, sometimes we have to make sure that it's in sync with what we're doing with Kairos or other digital tools that are publicly available.
Excellent. Paul, when you work with a lot of customers, you said over 1,000 hospitals. So as pertains to the people that should be at the table, so to speak, having these discussions, who do you think should be there? However you want to describe it. And the other thing I'd like to ask you is, when you see a customer or potential customer, you go in to have a conversation, and when you see things are not working well in this area, are there any commonalities? Like whenever we see this, it's a problem. When these two people aren't talking, it's a problem, or whatever. So wherever you want to start there.
Yeah, I think I'm definitely not in a position to probably say more than Will and Mona did in terms of the constituents that are available.
Okay.
I will add one. I think I can't remember if Mona stated this one, but I think the clinical constituent's a big deal. So having some clinical champion and a strategy for engaging with your docs to make sure that we are matching the right the right patient with the right provider is a really big deal. And sometimes that's as simple as showing profile A versus profile B and just saying, hey, this is what it looks like. This is the art of what's possible as a means of getting the juices flowing with those providers is a really big deal because there is a change management element to this, and engaging those clinicians, I think, is a really important part of this journey to get at that really robust underlying data set. So in terms of additional constituents, that might be one that I would add to the list. In terms of the question around, where is it that organizations would struggle?
Hmm.
I think that healthcare is a bit like we have the snowflake problem, right? You've seen one organization, so there's never exactly a singular pattern that will match across all of them. I think we hit on one really important topic, which is understanding that this is not just I build an app on top of an existing data store, and therefore I can go ahead and make this available to my patients and to my other end users. Treating this like a fundamental data management project and understanding the necessary governance is really a top-level leadership alignment question in my mind, because it is unfortunately difficult. And to the extent that you're looking to oversimplify things, that's a recipe for disaster right out of the gate, because there's real work necessary to support these things. So I would say, don't think of it just as an app, and rather about a fundamental change management process to empower data across the enterprise. That's the most common thing I would look at from a governance perspective, being one of the things that organizations should be on the lookout for.
Yeah, and it's not like a project, right, that finishes. This is an ongoing, this is forever. So we'll figure it out, get the governance in place, get the processes in place, get the right people involved, and this never ends, right?
The race with no end, Anthony.
It's
Yes,
a
that's
race
right.
with no end. It's just how it goes. All right, let's go to our Ask a Co-Panelist section, which I love. Paul, I'm going to let you go first. Do you have a question for one or both of your co-panelists?
So I do. I am curious for both Will and Mona, how you navigate this challenge of the need for transparency, right, to the patients and to the markets that you serve in, with the reality that a lot of times there are capacity constraints, within the delivery system today. You can't get access to primary care, or you can't get access to Dr. Famous. How do you think about balancing that? I think that those are two competing things that are difficult for executives like the two of you. And I'd love to have you share with the audience here how you think about that.
Mona, you want to go first?
Yeah, sure. I think, certainly capacity is a problem, major problem in some of our markets. And we have, our Dr. Famouses, of course. There are so many other providers that are wonderful and available. And I think it's really a matter of not making people think too hard about taking that next step. So if they're searching for a provider they really want to see, and that provider is not available, what can we do to encourage them to maybe try somebody else? And that has to happen in the flow of their search. You can think about it like oh, we also recommend this, or, other users are looking at these types of products. And so I think we have to do it the same way, give people different options. And again, don't make them think about it. Don't make them have to search around and redo their searches. Really important to just put it in the flow of what they're already doing to get them to the care that they need.
Hey, great point. Well, it makes me think of the GPS just rerouting you, right? Think about it. It just gives you, it knows there's traffic, gives you a new path. Will, your thoughts on Paul's question?
Yeah, it's pretty similar. Like a lot of our newer providers, or like more underutilized providers, like we focus on making sure that their profiles are up to date, that we've got videos, and that we're promoting them more. Like for the Dr. Famous, we're not really as worried about their profiles being up to date, because they're getting the traffic that they need. Like so it's really about focus. Like what Mona mentioned, we're trying to redirect, making sure that the ones with availability are promoted more heavily. Like we can do that within our tools, and just to make sure that that availability is showing up for the patients.
Excellent. All right, Mona, do you have a question for one or both of your co-panelists?
Sure. So I guess either Will or Paul could answer this one. My question is really around continuous improvement and continuous discovery. We have certainly put in place some real-time feedback in the digital space. We get a ton of comments every day where we're looking at, maybe setting up certain panels where we can ask just a couple of consumers every week just for their feedback. And I'm wondering if you have found success in certain approaches to continuous improvement and getting that feedback. Which ones have really worked for you?
Will, let's start with you.
I think probably like what I mentioned earlier is having that dedicated customer panels, like advisory groups in the different markets, and making sure that we have dedicated time and topics specific to digital health, digital tools. And that it has been very good. It's been very eye-opening that we find out that some of our patients don't even know what we offer. And so it's constructive feedback. So, but having that repetitive consistency of getting that feedback, and we do it quarterly in all the markets, it's been very positive to be able to get that that feedback to help us know where we need to go and where we need to focus and what's important to like what's important to them too. Like we might be focused on like getting more videos out and showing this, but we'll find out, well, they're not watching that video, so all they really care about is availability or scheduling. And so it's good to find that to be able to kind of redirect and refocus on what is really most important to our users.
Paul, anything you want to add?
Now, I would just add, I think that balancing the qualitative and the quantitative is always really, really important. I think Will's hammered home the point of qualitative as a complement to the data. And I think that that's so important to understand what's the problem we're actually trying to solve, and then hearing it from the voice of our users. It sounds pretty basic, I know, but it's a really important thing. So,
Will, would you like to ask one or both of your co-panelists a
Yeah,
question?
I have a question for Paul, and this might be a softball, and maybe it might be a hardball, but I'm more
Why are
curious
you
for
so great,
myself.
Paul?
I might be lobbing it up for you, but I'm curious to know, like, where do you see, Epic's coming out with like a provider finder? There's other tools in the market. Where do you see Kairos like differentiating itself going forward in this space?
yeah, I think that, thanks for the question, Will. I think there's two things that jump to mind for me. Okay, so first is, look, we have been craftspeople of provider data management now for 14 years. It is a subject with a lot of domain expertise, a lot of lessons learned, a lot of complexity. And, we continue to anchor on data being the core of what we do to empower a bunch of different experiences. I don't care if you're using, Epic's Find a Doc, if you're going to build your own website and do it on your own, if you want to use ours. Our belief is that we should help you build this golden record across what capacity looks like for your system, and then unleash that data to make those experiences awesome. Whether you use our products or somebody else's is fine by me. The second element of it that I think is really important, and that's a big philosophical difference between various organizations, of course. The second thing is, once you've done the hard work to make that data available, let's syndicate it and make it available to wherever it is that your patients begin their journey. It might be that they go to their health plan's website as a member to figure out, are you in network and what does this cost? It might be that they're going to go to Google. It might be that they're going to go to some other consumer grade website, or they might call your contact center. So don't purely think about it as a Find a Doc solution or just a provider search capability, and rather, hey, I've done all of this hard work to create a accurate digital manifestation of my inventory. Now I want to get it out there. I want for people, when they go search on Google, to have accurate information about our providers and about our organization, because that's meaningful in terms of my brand representation, my promise to market, as well as all of the operational efficiency that we get as an organization. And I think that's a pretty big philosophical difference as well. Like, let's syndicate the data and make it available to everyone such that it improves their experience as well.
All right, we're gonna do a lightning round, as I'll call it, of final thoughts, best piece of advice for someone in your position at a comparable organization. So Mona, let's start with you.
I would say just online scheduling experience, it has to be right. It has to be right from the start, and then you can continue to improve it. So be sure to spend your time and your money and your other resources getting this right. And not only is this expected right now, but it also allows your operations on the back end to be more efficient. So if you're wondering if you should spend time and money on this, yes, it's absolutely the first number one thing.
Awesome. Very good. Will, your final thought.
I agree with that, and my other thing is to make sure that you are getting like open and honest feedback on your tools, right? From a technologist, I look at things and I'm like, yes, this functionally works. I'm not necessarily looking at it from an aesthetics perspective or how somebody's going to look at it, but like I've mentioned a few times now, having that confidant like your wife that is going to be able to tell you like that your baby's ugly, or that this doesn't look good, or this isn't working well. You need somebody to be able to tell you that, because that is what your consumers think.
Awesome. Paul, we'll give you the last word.
Yeah, look, I think it's the whole purpose of this webinar, which is to just don't underestimate the importance of and the complexity of having accurate data to power the experiences of everybody from your clinicians to your patients. I'd like to tell you that it's really easy to do, but in fact, it's really difficult. Just don't underestimate it. I think it's a really important underlying assumption for this stuff.
Excellent. Well, that is about all we had time for today regarding continuing education. You could use the final slide in this deck. You'll receive an email when the on-demand recording is available for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming panels. With that, I want to thank our tremendous panel, Mona Bassett, Will Landry, and Paul Merrill. I want to thank Kairos for sponsoring today and you for attending. And with that, everybody have a wonderful day. Thank you.
Thank you.